kindly turn on the speakers. You can pause the video and watch it as many times as you need.
Hi, you are watching the pre-course materials for CAB CBLS. A lot of things have changed. We won't be talking about the old guidelines. We'll only be covering the new guidelines. So remember, CAB is what you're covering today. You need to watch this very carefully, learn from it, answer the multiple choice test, and bring that to your CBLS competency checkoff. And that's all you have to do. Have a nice day.
In this video, you are going to learn the following.
Checking responsiveness and presence, absence of normal breathing or gasping. Calling for help. Checking pulse. Initiation of cardiac compressions. Opening airway and giving 2 breaths. CPR for adults and pediatrics. CPR in the presence of 1 responder and 2 responders. Choking in adults and pediatrics. Summary.
Step 1. Check responsiveness. Shake and shout.
Sir, are you okay?
Step 2. Call for help. Alert for code blue. State cardiac arrest.
Sir, can you hear me? Are you okay? Code blue, room 4.
Conclusion.
Okay, so what you just saw was the shake and shout combined with the very, very rapid assessment of respiratory effort or gasping. Then, when I realized there was no response from the patient, no breathing present, I moved immediately to shouting for code blue, giving my location. And that, for this part of the process, is all you have to do.
Numbers for code blue.
Step 3. Check pulse for no more than 10 seconds. Check pulse.
For the pulse check, find the midline of the patient's trachea, place your fingers there, and then slide towards you into the carotid notch. You'll find the carotid artery here. Check the pulse for 10 seconds. If you feel no pulse within 10 seconds, immediately move to compressions.
Step 4. Give 30 compressions. Locate between the nipple line, at the center of the chest. Start cardiac compressions at least 100 per minute, 30 compressions delivered in less than 18 seconds.
Exposing the chest, I'm identifying the nipple line, the center of the sternum, placing the heel of the hand in the center of the sternum, hand on top, body over the patient, because these compressions need to be deep, at least 5 centimeters each compression, so I'm using all of my weight to push down on him, and I'm going to go at least 100 a minute. That means that 30 compressions should be delivered within 18 seconds. So, nipple line, center of the sternum, hand on hand, and then body weight over and compress. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Step 5. Open airway and give 2 breaths. Open airway using head tilt, chin lift. Give 2 breaths using CE technique. Remember to position the mask correctly. Remember to keep the airway open. In case of spinal injury, use jaw thrust to open the airway. Apply 1 hand on each side of the lower jaw, at the angle of the jaw below the ears. Use the index fingers to push the angles of the lower jaw forward. Maintain alignment of the head, neck and spine. Jaw thrust using bag valve mask. Putting it all together.
Sir, are you okay? Are you okay? Code blue, bathroom! Code blue, bathroom!
State cardiac arrest. Compression rate at least 100 per minute, 30 compressions delivered in 18 seconds or less, which is approximately this tempo.
I'm becoming very, very tired very, very quickly. So I cannot emphasize enough the importance of shouting code blue at the very beginning. If you've forgotten, then you better shout it now, because you could be here on your own for a very, very long time.
Continue 30 compressions for 5 cycles and so on. Remember the following. Allow complete gastric oil between compressions. Depth of compressions at least 5 centimeters. Minimize interruptions in chest compressions. Attempt to limit interruptions to less than 10 seconds. Head tilt, chin lift, suspected trauma, jaw thrust. Compression to ventilation ratio 30:2. Compression rate at least 100 per minute, 30 compressions delivered in less than 18 seconds. BLS in children. Step 1. Check responsiveness. Shake and shout. Step 2. Call for help, alert for code blue. State cardiac arrest. Step 3. Check pulse for no more than 10 seconds. If within 10 seconds, you don't feel a pulse, or the heart rate is less than 60 per minute, start compressions. To perform a pulse check in a child, palpate a carotid or a femoral pulse. To perform a pulse check in an infant, palpate a brachial pulse. Step 4. Give 30 compressions. Step 5. Open airway and give 2 breaths.
In the case of a child, we're still going to identify the nipple line and the midline, place the heel of the hand, and I want to still do 30 compressions at 100 compressions a minute. In this case, a depth of 5 centimeters or 1/3 of the depth of the chest of the child. So, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. If I'm a big male, I'm a big heavy man, I may only need one hand for this child, using one hand compressions. However, this is entirely dependent on you. If you're a small female and you can't do adequate compressions of 5 centimeters depth at 30 compressions, 100 a minute with one hand, use 2 hands. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Also, you may start with one hand but then become tired. You may need to do 2 hands. It is entirely dependent on the rescuer, not on the patient.